Hello, my name is Cassie. I'm going to be your nurse today.
Hi, I'm Connor.
Hi, nice to meet you.
Me too.
So what is it that I can help you with today?
Well, I just got diagnosed with type 1 diabetes, and I'm pretty unsure of how to give myself an insulin shot.
Okay, not a problem. That's a concern that many people who have just been diagnosed with type 1 diabetes has. But I'll be sure to teach you everything that you need to know. So at the end of this teaching session, I'm going to teach you how to give yourself an insulin shot. How does that sound?
Okay, sounds good.
Okay, so the first thing that you need to do is gather all of your supplies. You're going to need a couple alcohol swabs, your insulins, of course. You're going to need your insulin syringe, and then we just have an orange here that we're going to practice on, okay?
Okay, that doesn't sound too bad.
So you're going to have, looks like you have two types of insulin here, your regular and your NPH insulin. Both of these are going to be mixed in the same syringe before you inject them, and I'm going to teach you how to do this.
Okay.
Okay, so first things first is we're going to talk about how to store your insulin. So you're going to want to store both of these in the refrigerator, and right when you open them, you want to be sure to check each of them. Make sure that the clear one is in fact clear, and the cloudy one is cloudy and appears normal. You want to check the expiration date, which can be seen down here. Check those on both. And also, after you open your insulin, it expires 28 days after you open it. Some people find it helpful to write the date they opened it and then count to 28 days to see when it expires.
Okay, that's a good tip. I'll definitely do that.
Yeah, but you know, it's completely up to you, however you want to do it.
Okay.
Alright. And then you're going to want to clean the tops of your insulins, just like this.
Okay.
And then use your other side of it. Clean that.
Okay.
Alright. Next, we're going to be dealing with the needle. So when you're handling the needle, you want to be sure that you're extra careful, and you want to make sure that it stays sterile and that you don't touch anything with it, because then that would be contaminating it. So for example, if you are withdrawing your insulin and you're not planning on using the insulin right away, you want to make sure that you recap the needle to prevent the contamination.
Okay.
Okay. So before you drop up the medication, it's helpful if you actually inject some air into it.
Oh, okay.
So I'm going to show you how to do that. So for an example, if you need 0.4 milliliters of your regular insulin and 0.3 of your NPH insulin, you're going to draw 0.3 of your air. Can you see that there? And it's at the third little marking. And we're going to take this off, and you're going to inject it into this one, straight down, and just press that in, nice and easy. Then you're going to bring it straight out. And then it looks like you need 0.4 of your regular insulin. So again, you're going to draw the air in, just like that. And you're going to stick this one in the middle. And you're going to push down and inject your air. So after injecting into the regular vial, you can tip it upside down. And you're going to withdraw the 0.4. Just like that.
Okay.
Can you see the hash marks?
Mm-hmm.
Okay. So you're going to want to do that. Make sure all your air bubbles float up there. And then you're going to immediately put it into your long-acting. Flip this upside down. And then you're going to withdraw the 3. So since this one was 0.4, and your next one is 0.3, you're going to draw it up to the 0.7. Does that make sense?
Yep.
Okay. So we're going to draw that one. Alright, so after you withdraw the insulin, you want to make sure to get rid of any air bubbles.
Oh, okay. How do I do that?
Okay, so you see these little air bubbles in here?
Mm-hmm.
You want to make sure that they float to the top. So to do this, you just give the insulin syringe a couple flicks and wait until the bubbles move up to the top.
Oh, that makes sense.
So we're going to talk about a few of the different places that you can inject the insulin. So the most common place is your abdomen because medicine is most readily absorbed there and has a little more fatty tissue. A lot of people like to use that, but they can also use your arm, your thigh, or your butt. But again, the abdomen is the most common because it has that fatty tissue.
Gotcha.
So when you're injecting into the abdomen or any area that does have that fatty tissue, you want to go in at a 90-degree angle, which is just straight down. And you're going to go in at that angle and come out at that angle. However, if you were wanting to do it in your arm or someplace that had a little bit less fatty tissue, you would want to go in at a 45-degree angle to make sure that you still stay in that fatty tissue, okay?
Okay.
And you want to withdraw at that angle too.
Okay. And then what do I do with the needle once it's done being used?
Okay, so once the needle's done being used, you're going to discard it in a container. You want to make sure that you put it in a safe container. A lot of places have actually sharps containers that you can get.
Oh, okay.
So where do you think that you'll most likely give yourself the injection?
Most likely in the abdomen.
Okay. So when you're doing this, you want to be sure that you clean your skin with an alcohol prep pad. So we're going to do that. So just like this, you're going to kind of hold it like a dart. You're going to go straight in. You're going to press it in, just like that. And then pull it straight out at the same angle. And once you're done, you press down a little bit harder, just like this, and you're going to set the safety off, so then you can't poke yourself with the needle,
Okay.
and then that's when you would dispose of your needle. Alright, Connor, do you think that you could practice an insulin injection for me?
Oh, okay.
Okay.
Okay, so first I would wash my hands.
Mm-hmm.
Okay. Then I want to check the vials. Make sure that this one looks clear. And this one looks cloudy.
Yep, very good.
Okay. And I want to sanitize the tops of them. Here. Turn it over. Clean that one off.
Good.
Okay, so then I want to take my needle. So I get the correct measurement of air for the first one.
Yep.
Get the right measurements of air for the second one. Straight down. Good.
Good.
Okay. And then now do I do the intake?
Yep, now you do the intake, so you would start with this one,
Okay.
and you would get your proper measurement of that.
Okay. Like that.
Yep, that's really good.
Okay. And the same thing here.
Yep, the same thing there.
How's that?
That looks good.
Okay. And I want to make sure that I get all the air bubbles to the top. Okay, like so.
Good, perfect.
Good?
Yep, that looks good.
Okay. And then do I sanitize the skin now?
Yep, now you would sanitize the skin.
Okay.
You're doing so well.
Thank you.
You're a fast learner.
Thank you. Nervous because it's my first time.
That's okay, a lot of people get nervous.
I clean the skin.
Mm-hmm.
And then since I'm going to do it in the abdomen, I just go straight down, right?
Yep, a 90-degree angle.
Straight in.
Nice.
Just inject.
Yep, inject nice and easy. Good. Now you can pull the needle out.
Good.
And then set off the safety. Perfect. So something that I didn't mention earlier, but I want to make sure to point out now, when you're injecting in the abdomen or the arm or wherever you decide to, it's important to not massage the area afterwards, as that's not the proper technique. The site, however, it might bleed, so it is okay to apply a little bit of pressure.
Okay.
Okay? Does
Yep.
that make sense?
Yep.
Okay, well, you did an awesome job with your practice injection. You're a very fast learner. Do you have any other questions for me about your insulin injection?
No, I think I'm good.
Okay, well, good luck to you, and if you have any questions, don't hesitate to call me, okay?
Okay, thank
I'm
you.
going to leave you with some of these reading materials. Kind of gives you a step-by-step on how to inject your insulin and on your different types of insulins. So like I said, if you have any questions, feel free to give me a call, okay?
All right, thank you.
Thank you.